Acne has become a misunderstood, misdiagnosed, and extra treated disease as of now.
Does this diet always causes acne?
It will add to acne
Okay.
rather than it itself causing acne. But when they reduce the lipids or the diet rich in glycemic index,
Okay.
when they reduce such substances in their diet, they have noticed significant reduction.
Doctor, what should a basic acne-prone skincare routine include?
So, sir, it is not about skincare routine per se. If a person has acne, that means first thing first, he needs to consult a dermatologist rather than he himself starting any skincare routine, because this is a pathological condition.
Right.
If pathology is there, that means there is a disease. That means he needs to get treated at the first place. If I have to tell it, then he has to use a moderate, a gentle skin cleanser kind of thing, and then he has to use non-comedogenic products like non-comedogenic moisturizer or non-comedogenic sunscreen, and he has to not apply any actives if not recommended by a dermatologist, because acne is prone, like acne skin, acne prone skin is in such a way where whatever active ingredients you're gonna use, you're gonna create sensitivity for your own skin, and that will lead to multiple breakouts. So a proper skincare routine for acne is not finalized. It is depending from person to person, and it varies from person to person.
Okay, okay. And see, nowadays there is lot of talk about serums, like can say niacinamide and other kind of serums.
Yeah.
Are they really effective for acne?
It is not like effective like totally, because it is not going to be a standalone treatment.
Okay.
Yes, niacinamide is going to help, but for what type of skin is what matters. Okay, so basically niacinamide will help in oil control and improves the barrier function, and it does its job. But to prevent acne or to treat acne, it actually needs acne specific treatment. Niacinamide will act like an add-on, the additional thing, rather than just a standalone treatment. So always and always consult a dermatologist before you start any kind of active ingredients like niacinamide.
So once again, same thing. Like as already you narrated, I had that question: is niacinamide treatment for acne? So
Yeah, we just discussed the
yes,
same. Let us make it again clear that
right.
it is not a standalone treatment,
Okay,
and the pathology needs treatment. So
right.
always consult a dermatologist.
So is this once again same question? Niacinamide, is it safe for teenagers?
Teenagers, at times what happens is we have to look for the skin type, sir. Like whether the patient has or the person has normal skin, or is it dry skin, or is it oily skin, or is it combination skin, and then only we can actually comment about it, because a person not used to any active ingredients, and if he uses niacinamide, there might be some irritation or some sensitivity happening for their own skin. So it is advisable to just know your skin type at the first place, and at the second place consult the dermatologist, and then go ahead with the active ingredients.
Okay. Doctor, this again the other ingredients commonly, like we see a recommendation for acne is salicylic acid.
Yes,
So can you
yes.
explain how it works?
So salicylic acid is an acid. It is an acid. We should always remember that.
Yes.
It helps in removing the clogged pores like blackheads and whiteheads, whatever
Okay.
is being told. It actually helps in removing that. So what basically happens is it induces a dryness, and then it removes the clogged pores. So yeah, it is a good thing, and it will also help in pigmentation, not just in acne. Acne induced hyperpigmentation also it helps very well. At the dose of like 1% or 2% salicylic acid, it helps very well.
So does it causes dryness after using?
Yes. So not to everybody, but yes, we have encountered cases where a client of mine actually used the salicylic acid, and suddenly the client got irritation and dryness, and there was a lot of redness on her face. And when I asked her to stop, it got reversed. So
Okay.
then I realized, so salicylic acid is not for every skin.
Right.
So you need to finalize, you need to give a test patch and then only start it, rather than, starting it immediately, just like a normal skin routine. It is gonna create a lot of blunders rather than wonders.
Okay,
Yeah,
right. So, coming to this question only, like we also hear about encapsulated.
yeah.
So, this is, I think, the new technology. I feel that encapsulation salicylic acid. What does that encapsulation mean?
So encapsulation is where a salicylic acid is inside the capsulated form, and then it will not directly release the salicylic acid. Instead, it will slowly release the salicylic acid, which will probably reduce the dryness, the irritation, and the issues what the direct salicylic acid is causing on the skin of patients. So this might be a game changer if it is going to be used at the proper dosage and for the proper duration and for the proper patient, and in a proper way. This will actually create a better result. So this is going to be a game changer probably in coming days.
I think this is what I understand is so slow process or the
Yeah.
efficacy of that product, because salicylic acid when we use face wash or anything, immediately like you wash it and your skin become dry. So
Yeah,
maybe here that technology, I think it will help.
it will
So in a slow
probably.
process, and it helps the reducing those dryness content, I
Yes,
feel,
yes.
right?
Hopefully, this will
Okay.
be a game changer.
Yes,
Yes.
yes. So we'll come to next question. What are common mistake that people make while dealing with acne?
Well, my aunt used to tell me, so when even I used to get acne, and she used to be like, "Come, let me pop this pimple. It will
Okay.
go forever." So do not do that, because that will actually create one, scar; two, hyperpigmentation, and the scar might become ice pick scar, or rolling scar or box scars, and that will be forever, and that needs a lot of treatment. So try to not to pop the pimple, and that is most important. And what happens is, we give some cream to the patient, and they'll be like using it excessively just to make sure that it goes in time. So that is not the case. So that will have a half life, and that will have its own time, and only then it is going to go. So do not overuse the ingredients what the
Yes.
dermatologist
So
tells.
always you people suggest steroids if you are taking. So without doctor, suggestion, do not go. So if
Yes.
their symptom comes down, they go on,
Yeah,
using it.
that's the
So there
thing.
are many, side effects. So
Side effects,
it is
correct.
the same, vice versa
Same way.
combination, we can
and
say.
and and there are a few people who over exfoliate,
Okay.
just like they try to scrub it off, they try to rub it off, they try to over do the things like washing the face regularly. Yeah, that's a good thing, I don't say no, but using it, trying to rub it more often will actually create more problems. So whatever is normal, your skin is normal, your skin is perfect. Let us keep that in mind first, rather than being like getting affected, saying acne is gonna be lot of things, like people are gonna look at me like some devil, I cannot show my face to the public, and you try to overdo things which will create a lot of issues
Yes,
in
yes,
future.
yes.
So let us be very humble towards the patients who have acne, because this is just a pathological
Yes,
condition
yes.
and it can be cured.
Yeah,
It,
this is like social emotions when the
yes,
teenagers when they go to college,
yeah,
obviously. Like earlier we used to say girls, now even the boys, they are very
uh,
much, I think that.
yeah, yeah.
So
E-
even
Everybody is concerned, sir.
yes.
Everybody is concerned, and this is something which can be cured. with
Right.
proper skincare routine and proper acne treatment, and targeting exactly where it has to be hit, I think it is going to give wonderful result. So make sure you're consulting and then go ahead with the products that will give you beautiful skin, because your skin is not just for 20 years or 30 years. You will
Right.
need the skin for rest of your life. So you need to maintain that. So for that reason, I feel, consulting dermatologist for acne is compulsory.
Right. So thank you, doctor, for breaking down this acne in such a clear way that we can understand that, as you explained. To summarize, so acne is a multifactorial condition, right?
Correct.
So influenced by hormonal effect and oil production or inflammations.
Yes,
Okay,
yes.
it is not just a teenager problem,
No, no,
teenager
no, no.
issues, and the proper guidance, as you said, is very, very important. So if acne is painful, persistent, or leaving a scars, so please consult your qualified, like a dermatologist, and you will get a proper treatment, and you can keep your skin healthy. Thank you, doctor.
Thank you. And I would like to also tell that acne is curable. Okay. So let us properly be in a situation where we'll not be discriminating people. Most of the time, I have heard my clients telling that my friend group is always teasing me about acne. This is just a normal pathological condition and it can be cured. So please don't get disheartened. And most of the time, this has become a psychological issue rather than, becoming a pathological issue. So
Exactly.
both stress will actually induce acne. So you will not know whether stress has caused acne or acne has caused stress. So this will become a vicious cycle. So let us be considerate about the patients who have acne, and I'm very much sure and I'm 100% sure you will be cured if you're guided the right way and if you're treated the right way by a proper dermatologist. And I think you will be fine. And please never ever discriminate people who have acne. It is just a pathological condition. So thank you so much for having me here on this podcast. And I think I have tried my level best to make sure to break down things which were required and which will actually help in future for acne. Thank you so much
Yeah.
for having
Thank
me,
you.
sir.
Thank you.